Feeling tired all the time. Pale out of breath. A lot of people might say, oh, that's just part of being pregnant. But what if it's something more? Hi everyone, I'm Alvin, and today we're rediving deep into a topic that affects so many pregnant individuals, but is often dismissed. Iron deficiency, anemia. It's more than just feeling tired, and understanding it is crucial for a healthy pregnancy for both you and your baby. So, let's start with the basics. What exactly is happening in your body during pregnancy? Well, it's pretty incredible. Your blood volume can increase by almost 50%. This is to support the placenta and your growing baby. But here's the catch. While the liquid part of your blood, the plasma, increases, the number of red blood cells might not increase at the same rate. This essentially dilutes your blood. Now, your body needs iron to make a super important protein called hemoglobin. Hemoglobin is what's inside your red blood cells, and its job is to carry oxygen from your lungs to the rest of your body, and of course, to your baby. When you don't have enough iron to produce enough hemoglobin, you develop iron deficiency. Anemia is the most common type of anemia, especially during pregnancy. Now, you might be thinking, okay, I get it. Less iron, less oxygen. I feel tired. But the signs of anemia can be much broader and sometimes quite surprising. Let's talk about 7 unexpected signs you might be overlooking. Number 1. That persistent, bone-deep exhaustion. We're not just talking about the usual first trimester fatigue. This is a level of tiredness that doesn't get better with rest. You might feel weak and struggle to get through your daily activities. It's a profound lack of energy that feels different from normal pregnancy tiredness. Number 2. Paleness in specific places. Forget just looking pale in the face. A key sign doctors look for is paleness in the inner lining of your lower eyelids. Just gently pull down your lower eyelid and look in the mirror. If that area looks pale pink or even yellowish instead of a healthy red, it could be a sign. The same goes for your nail beds and the creases in your palms. Number 3. Dizziness or feeling lightheaded. Ever stand up too quickly and feel like the room is spinning? When your body isn't getting enough oxygen, your brain can be one of the first organs to feel it. This can lead to frequent bouts of dizziness or feeling like you might faint. Number 4. Heart palpitations. This one can be scary. You might feel like your heart is racing, fluttering, or pounding in your chest. When you're anemic, your heart has to work much harder to pump oxygen-rich blood throughout your body to compensate for the lower oxygen levels. This extra strain can cause these noticeable palpitations. Number 5. Shortness of breath. Do you find yourself getting breathless from simple activities, like walking up a single flight of stairs, or even just talking? Again, this goes back to oxygen. With less hemoglobin to transport it, your body struggles to get the oxygen it needs, making you feel short of breath much more easily. Number 6. Strange cravings. This is a really fascinating one. Have you ever heard of Pica? It's a condition where people have intense cravings to eat non-food items. We're talking about things like ice, dirt, clay, cornstarch, or even paper. The exact link isn't fully understood, but Pica is strongly associated with severe iron deficiency. So, if you find yourself wanting to crunch on a cup of ice all day, it's worth mentioning to your doctor. And finally, number 7. Cold hands and feet. Poor circulation is another sign. When you don't have enough healthy red blood cells, your body prioritizes sending blood to your vital organs, which can leave your extremities, like your hands and feet, feeling constantly cold, even in a warm room. If any of these signs sound familiar, don't just brush them off as normal pregnancy symptoms. The good news is that diagnosing anemia is very straightforward. Your doctor will order a simple blood test called a complete blood count, or CBC. This test measures several components of your blood, including your hemoglobin and hematocrit levels. In pregnancy, the guidelines are a bit different. Generally, if your hemoglobin level is below 11 grams per deciliter in the first trimester, or below 10.5 in the second and third trimesters, you'll be diagnosed with anemia. Once you have a diagnosis, what's next? The treatment plan usually starts with the most logical first step. Your diet. There are 2 types of iron you can get from food, and it's really important to know the difference. First, there's heme iron. This type of iron is found in animal products like red meat, poultry, and fish. The great thing about heme iron is that your body absorbs it very efficiently. So, including lean red meat, chicken, or salmon in your diet can be a fantastic way to boost your iron levels. Then there's non-heme iron. This is the type of iron found in plant-based foods. Think of things like lentils, spinach, beans, tofu, and iron-fortified cereals. While these are all excellent, healthy choices, your body doesn't absorb non-heme iron as easily as heme iron. But here, as a crucial tip that can make a huge difference, you can significantly boost your body's absorption of non-heme iron by pairing it with vitamin C. It's like giving the iron a helping hand. So, when you're having a spinach salad, throw in some bell peppers or tomatoes. When you eat your iron-fortified cereal in the morning, have a small glass of orange juice with it. This simple food pairing strategy can more than double the amount of iron your body actually uses. On the flip side, there are also things that can block iron absorption. The main culprits are compounds called tannins, found in coffee and tea, and calcium. Tea's manseates. A good idea to avoid drinking your morning coffee or tea right alongside your iron-rich breakfast. Try to leave a gap of at least an hour between them. Similarly, while calcium is vital in pregnancy, try not to take your calcium supplement at the same time as your iron supplement or iron-rich meal. Now, for many people, especially during pregnancy when iron needs are so high, diet alone might not be enough to correct a deficiency. That's where iron supplements come in, and they're an essential part of treatment. Your doctor will recommend the right type and dosage for you. But let's quickly go over the common options you might see. The most common and affordable one is ferrous sulfate. It's been used for a long time and is very effective. Another option is ferrous glucose. Some people find this one a bit gentler on the stomach. Then there's ferrous fumarate, which actually contains a higher amount of elemental iron per dose. And another one is carbonyl iron, which is often considered to be gentler and may have a lower risk of toxicity in case of an accidental overdose, which is an important safety feature. A common complaint with oral iron supplements is side effects, especially constipation and stomach upset. It's a real issue for many. To Manakites, you can try taking your supplement with a small amount of food, even though it might slightly reduce absorption. Upping your fiber intake with fruits, vegetables, and whole grains, and drinking plenty of water throughout the day can also make a huge difference in keeping things moving. In more severe cases of anemia, or if someone simply can't tolerate oral iron supplements due to intense side effects, there are other powerful options. Your doctor might suggest intravenous or for iron. This is administered directly into your bloodstream through an IV drip in a clinic or hospital setting. Formulations like iron dextran or furomoxidil can get your iron levels up much more quickly and bypass the digestive system entirely. It's so important to remember that treating anemia isn't just about helping you feel less tired. It has a direct impact on the health of your pregnancy. Untreated iron deficiency anemia is linked to increased risks of preterm delivery, having a low birth weight baby, and even postpartum depression. Taking care of your iron levels is a proactive step towards a healthier outcome for both you and your little one. So, listen to your body. If you're experiencing that deep fatigue, shortness of breath, or any of the other signs we talked about, please bring it up with your doctor or midwife. A simple conversation can lead to a simple test and a clear path to feeling better and ensuring a healthier pregnancy. You don't have to just power through it. There is help available, and you deserve to feel as good as possible during this incredible journey. Thank you so much for watching. I hope this information was helpful and empowering. If you found value in this video, please give it a thumbs up and consider subscribing for more content on health and wellness. Stay healthy and take care.